Our first speaker of the day is Courtney Clyatt. So Courtney is a senior program officer for engagement at the Patient-Centered Outcomes Research Institute, or which we all call PCORI. She came to PCORI with more than 10 years of experience in public health and project management. In her position, she's played a vital role in engagement awards, and specifically the Pipeline to Proposal Awards, which funded community building and engagement projects. Currently, her work has been focused on helping smaller organizations like our own to build capacity to engage in patient-centered, comparative effective research. So please join me in welcoming Courtney.
Thank you for that introduction, Dina, and thank you all for the warm welcome. All right. It's been a pleasure to meet several of you and have the opportunity to hear some of your stories. It really makes the work that PCORI funds tangible, knowing that the funding that we provide allows you all to gather, allows you all to connect through researchers, whether you be researchers, clinicians, stakeholders, or family members. So let's see, get started. So my disclosure is that I'm a PCORI staff member. And then I wanted to allow you to hear from one of our rare disease advisory panelists who gives kind of like the lays the land for what it's like to work in the rare disease field in CER.
This idea of patient engagement is so central to both NORD and PCORI's work. And it's really this idea of trying to think about how do we ensure that every step of our research really brings in patient voices, brings in what's important and meaningful to patients as they think about their lives and living with these rare diseases. Patient-centered outcomes research, comparative effectiveness research within the rare disease space is so important because rare diseases are just different. They're not the same as what we see in chronic disease. And so we need to think about the research differently to make sure that we know how to do patient-centered outcome research in CER in the rare disease community because it's such critical research for this community. We need to really think about giving patients the opportunities to understand their options, potentially sometimes in places where the options are kind of limited and we don't have the perfect option. And so we really need this work and this methodology and this body of research specifically in the rare disease community so that we can figure out how to do this right and how to do it in a way that really supports the community and advances their wellness and well-being.
Thanks for your attention to that. So next I'll share a bit more about where I work, PCORI, the Patient-Centered Outcomes Research Institute, from whom Tango 2 has received, I believe it's 2 awards at this point, perhaps more in the future. But again, they've received 2 engagement awards. And moving right along to the PCORI overview. So PCORI's vision is to ensure that patients and the public have the information they need to make decisions that reflect their desired healthcare outcomes. And we do this by helping people make informed healthcare decisions and improve healthcare quality, healthcare delivery, and outcomes by producing and promoting high-integrity, evidence-based information that comes from research guided by patients, caregivers, and the broader healthcare community. Some of the key features of the funded research include projects that engage patients and other stakeholders throughout the research process. So looking to you as patients, clinicians, researchers, really to work together to identify and prioritize research topics, to design and conduct the studies together, and then share those results. So PCORI funds comparative clinical effectiveness research, which compares 2 or more medical treatments or services or health practices to help patients and stakeholders make better informed healthcare decisions. And our funded work focuses on answering questions most important to patients and those who care for them. PCORI has a total of 12 topic themes of interest that will inform our focused funding opportunities over the next several years. And these themes focus on populations, health behaviors, and health conditions. And you all can see yourselves reflected in this because we focus on promoting healthy children and youth, as well as addressing rare diseases. Since its authorization by Congress in 2010, PCORI has awarded more than $4.5 billion to fund more than 2,400 research and research-related projects. So through our Comparative Clinical Effectiveness Research Awards, our Eugene Washington PCORI Engagement Awards, and also through our National Patient-Centered Clinical Research Network known as PCORNet. I'll talk in a moment about engagement in research. So speaking on engagement in research, this slide here just shows you what the continuum can be and how it's not just at one point that researchers and patients should be working together, but from the very beginning, identifying research topics, research priorities, all the way through to then working together to disseminate that information back to the communities with whom they're closely in touch with. And so PCORI's funded research focuses on patients and other healthcare stakeholders being equitable partners and having meaningful engagement. And PCORI believes that engagement of non-traditional stakeholders can increase, can increase the uptake of those research findings as it applies to various communities. The PCORI Engagement Awards, the Eugene Washington PCORI Engagement Award Program, is intended to bring more patients and caregivers and clinicians and other healthcare stakeholders into the research process. This goal is to support projects that will build a community, such as yourselves, better able to participate in PCOR CER and serve as channels to disseminate that information back to your communities. And engagement awards are research support projects. So while we don't fund the actual clinical research during these projects, it's an opportunity to build the community, as you all have done here. And this slide here just shows an example of how you can have a research team, but until that research team includes patients, family members, caregivers, community-based organizations, as well as the researchers, clinicians, and other stakeholders, it's not truly patient-centered. Here I want to give you an example of a project that was funded and they realized that they were having some challenges in bringing in folks to recruit them for this research study. So the study team was planning to evaluate interventions to improve quality of life for Latina breast cancer survivors and their caregivers. However, as I mentioned, they were having difficulty enrolling people in the study. So the study team brought together patients, clinicians, and community groups to identify strategies for increasing participation and intervention components. The effect of these various voices at the table brought about an expanded eligibility criteria for survivors, which meant that anybody who was a Latina breast cancer survivor could participate in the study. They also discussed the burden that folks would have on them by having to attend so many sessions. So they reduced the number of intervention sessions, and this helped to improve participation as well as retention in the study. And then they also heard from patients that they wanted to hear more about stress reduction and what it meant to be a breast cancer survivor and experience sexual intimacy. And so the study team then brought in specialists to create workshops to discuss these topics that were salient to the patients themselves. And then I think it's then that you really see where that patient voice stands out because they were listened to. And again, as I mentioned, they were able to increase their enrollment as a result of the patient voice being heard and listened to. So this next slide just shows you what the continuum of engagement practices are. So it can range from consultation to a collaboration and then shared leadership. For a number of our engagement awards, we do expect that there is co-leadership where if the project lead is a research institution or a university, then that project co-lead may be somebody from the community side, so that there's joint leadership and not just one perspective being considered. And this is a further example of, basically putting your money where your mouth is, right? So making sure that there's fair compensation behind everyone's participation in a project. So you're paid for your time, you're paid for your contribution. Just as doctors may be paid for their time, patients can also be paid under the PCORI Engagement Award Program. I'll talk a bit more now about rare disease and PCORI. So PCORI does recognize that rare disease has its own limited challenges when it comes to CER. And so that can be limited sample size, limited understanding of natural history, limited evidence-based guidelines, and limited generalizability of research findings. And recognizing that, as well as working with our Rare Disease Advisory Panel, PCORI has recently created a funding opportunity that allows for things that are more specific to rare diseases and in general, such as approaches to symptom management for individuals with rare disease. This could include behavioral and symptom relief treatments and techniques for like sleep disturbance or techniques to address pain. The second is approaches for timely diagnosis of rare diseases. So recognizing that the diagnostic odyssey can be between 3 and 15 years with an average of 5 years, PCORI is interested in studies that compare approaches to decrease that length of time. For example, by comparing genetic testing approaches for newborns with serious illnesses of unknown cause. And then finally, with that funding announcement, they were also seeking approaches to improving care delivery for individuals with rare disease. And some examples may include models of care for children with rare disease transitioning to adult care. This slide here just shows you an example of how much PCORI has funded over the years in rare disease. So $121 million for 42 clinical comparative effectiveness studies. PCORI's investment in rare disease is actually even greater when considering the investment made from the Engagement Award Program as well as PCORNet. This next slide, oh, that's not in there, okay. So I did have a slide that showed some of the rare diseases that have been funded, excuse me, for comparative effectiveness research. And so I just wanted to, I just wanted to share with you that there is CER that can be conducted with rare diseases. This slide here is an example of that. And so it shows that there was a funded project on Kawasaki disease, and the project was called the Kid Care Study, where they compared treatments for resistant Kawasaki disease. And Kawasaki disease, if you're not familiar with it, can lead to widespread inflammation of the blood vessels and can result also in persistent fevers. In this study, 103 children ages 4 weeks to 17 years with resistant Kawasaki disease were evaluated. All received care at 30 health centers across the US, so it was a large pragmatic study. The results of the study showed that one treatment was more effective than the other at reducing hospital stays, giving patients fewer side effects, as well as alleviating symptoms, including those persistent fevers. And so with this information, knowing that there are multiple treatments that their children can take, parents now have a better choice to make when it comes to treating their children and deciding which treatment they should receive to address their Kawasaki disease. So I'm just about done, but I did want to acknowledge the work that Anne, Dina, and Kasha have done under their Engagement Award project. And so I want to talk to you a bit about next steps. And I meet with Dina, I combined you, Dina, Anne, and Kasha on a monthly basis to discuss their current Engagement Award project. And the other day, I also had an opportunity to meet a mother and daughter team who are working with that project. And it's pretty amazing just to see that, as I said at starting, to see folks just involved in the projects that PCORI is funding, because it makes it much more real and much more tangible. So when I go through those review sessions of 3 hours long, I'm like, okay, this is the face of why I'm doing this. This makes it clear and understandable of like the stress and the frustration of going through these meetings. And so I wanted to share that one of the tasks of the current Tango 2 engagement project is to create a roadmap that will guide Tango 2 Research Foundation's next steps in research. And this is where you come in. And I understand that your involvement in this process, you're here today, but we need your voices. We need to hear from you, get your thoughts, bring that together to create the roadmap that will guide the next step. I hope you also understand the importance of your role and that you will contribute and hopefully strengthen your communities through your contribution. So thank you for your time. My understanding is that, as Dina mentioned, you can submit any questions you may have for me in Slido, and they'll be answered at the end of the day. I'll be back. Maybe in different clothes, but I'll be back.